Back and you're watching News Channel 3 live at 9. We knew it was going to happen, and now it is here.
The Shelby County Health Department confirmed over the weekend that 2 people have been diagnosed with the new Omicron COVID variant. And to discuss the very latest in the fight against the coronavirus, we're live with infectious disease specialist Dr. Stephen Threlkeld. Stephen, always good to have you. Thank you for your time. I am sure you are not one bit surprised, yes or no?
No, as you say, it was on its way. The concerning thing about this variant are obviously the resistance. It's taken us backward in our immune protection. And unfortunately, other ones have done that before, Beta and Gamma, but none of them have been able to take on Delta head-to-head, toe-to-toe with respect to contagiousness. And this one has. It's actually taking over Delta. So 2 of the important 3 dominoes have fallen. Thankfully, the virulence or deadliness domino did not fall. It doesn't, at least preliminarily, appear to be any more deadly than the other ones. And that's the one where you really have to watch out. You get all 3 and you really, really are in trouble.
No doubt about it. Yeah, so, Doctor, what about the vaccinated versus the non-vaccinated when it comes to this new variant? Where do we stand with that?
Well, unfortunately, we still have 100 million plus people in this country, about 30%, who aren't going to take the vaccine, and they are every bit as vulnerable in this situation to severe illness and death as they were before, maybe more so because it's even more contagious. You're twice as likely to get it from a close contact as you were even Delta. So the unvaccinated people are, remain a very big problem for themselves, and then also they just keep churning that problem of filling hospitals. Those are the people that are getting hospitalized and dying of this infection. They always have been since the vaccine became available.
So since the virulence is a problem for the unvaccinated, does this worry you that the next variant could create serious illness in the vaccinated? The variants seem to be getting smarter.
Yeah, and that's what there's this kind of idea out there that these things are going to get less and less virulent as we go. We certainly can see that, but in some things like the flu, we see that after pandemics. But there's no reason that has to be the case. Yes, that third severity domino could fall as well. If you get that, then you're really back to square one. We hope that doesn't happen, but obviously we're moving against that by trying to generate new variant vaccines to be able to boost if we do see this sort of thing. So yeah, the virus can move us backward. It certainly has with Omicron.
So, Doctor, go ahead. I'm sorry.
No, I say without boosters, you really have you've cut the immunity a great deal right now.
Let's also talk about booster shots. We are hearing so much talk about the need for all of us to get that third shot, especially if you had Pfizer. Where do you stand with that? What do we need to do with that booster shot?
Well, it's interesting. That's been one of the more controversial things with respect to COVID-19, and that's saying something in this topic. The advisory panels have not been having unanimous votes in the past about who should get the booster when, but Omicron has made it a lot more clear. You see a 40-fold, in some studies, drop in those all-important neutralizing antibodies to Omicron compared to Delta. So I think it's made it much more clear that people are going to need that booster now to restore that protection, get us back to where we were, at least with Delta and before that. So I think it's made it much easier for the advisory panels, for the governmental agencies to say, look, everybody needs to take this, both to protect themselves and to keep this virus from circulating as effectively in our communities.
I almost don't even want to ask this question because it might feel like more division or raising the specter of that. But with regard to getting the vaccination, I mean, let's assume that everybody, whether they want the vaccination or don't, want this thing out of here. Having a large segment of the population unvaccinated, does that make it easier for the virus to mutate, or does it not? Is that a factor in these constant mutations?
Absolutely. These mutations are simply random spelling errors, and the more copies that virus has a chance to make for itself, the more errors can be made. And then you have countries that have less than 10% in the way of vaccination in the entire country. And as we know now, what happens in South Africa does not stay there. Things can circulate around the globe very well. And one thing that's important, physicians are about 50% Republican, Democrat. They make up a very large segment of the population now. 97.8% of physicians are vaccinated fully against this. You don't get that kind of unanimity for apple pie and mom, and so people should take notice of that.
Well, so apple pie is pretty big, Stephen.
One last thing, Doctor, very quickly here. Of course, the Christmas holiday coming up, New Year's right around the corner. What should we do about gatherings? What do you recommend?
Well, the most important thing you already said is to get vaccinated and boosted. I think that's going to be the biggest thing. If you have people, particularly who are unvaccinated, then I think you have to avail yourself of things like testing. You can test the day of an event now. The home tests are pretty good. They're not perfect, but they're pretty good at plucking out people who are going to be contagious to others. And then, of course, you can use masks and some distancing in folks who are unprotected. So I think the most important thing is to vaccinate, but use those other modalities, too, to protect if you can't have a gathering that is totally vaccinated.
All right.
Dr. Stephen Threlkeld, Baptist Hospital, thank you very much for all that you do.
Thanks, guys. Good to see you.
Good to see you as well.
Who